Ugh. Welcome to the first video of my vlog. I've dived in and decided to do it. So yeah, come watch my journey. I'm in my wife's car. I'm going to go get a few equipment pieces to start working up my first patient, I guess. And I'm going to show you how I do it. I've parked ages away because sometimes I think that my wife loves her car more than me. So I just want to make sure that nothing happens to it. Sometimes I feel like this is just so lame to do, but I'm going to dive headfirst into this and hopefully stay in one piece and you guys enjoy this journey that I'm recording. Well, I'm in Target and thought it opened at 8 o'clock. Unfortunately, it opens at 8:30, so I just have to wait. I should also say that my wife's away right now. We're both working part-time and she really wants to save money, which I totally agree with. So I'm just spending money that I'm not supposed to just for this vlog. In case you're wondering, there is a couple of whiteboards on Marketplace that I could probably use, but I think that I want a clipboard or a clip. I don't even know what they're called, but you know what I mean. I want some butcher's paper where I can click and I can really write my ideas of what's going to be going on. I asked my friend, who's actually my best friend, ChatGPT, what's it called? It's called a flip chart, just so you guys know. I also want to add one more thing. I can't read my own handwriting half the time, so I'm not really sure why I'm investing in this. But I think it's really important for you guys to see how my brain works and how I'm going to represent each of the symptoms, work through this case, and decide on a diagnosis. So yeah, I just think it's really important. And I guess, you know, from my childhood of when I didn't get my pen license, it's really my time to shine there. I chose these ones just because they can clip onto the whiteboard because, again, I have no attention to detail. Aesthetics isn't that important to me. So anything that helps me clean and tidy keeps the wife happy and everyone happy in the household, and probably you guys watching me.
Oh.
Hello! All right, this lovely lady, we're trying to find a whiteboard on the stand, and this lovely lady
right here.
Thank you so much. Kylie is helping me find this, and I love it.
There you go.
And she was singing and living her best life.
And I was shopping for a customer, and I needed to find this for a customer, and now I found it for you.
Thank you.
There you go.
Thank you so much,
You're
Kylie.
so welcome.
Bye.
Because I've never ever heard of a vlog until they started talking about, I think, on Celebrity last night.
Come here.
Hello.
Okay, so I've just told Kylie about my vlog, and what do you think about it?
I'm so intrigued, so excited.
Yeah.
Cannot wait to follow you because I'm very interested. I'm into all that sort of stuff, so I would love to. Oh, this is so special. I love it.
And then, do you even know what a nurse practitioner is?
Is it to do with nursing, or are you into helping other people?
So you can be a specialist in your field, I guess. And so for me, I'm in emergency.
Oh, wow.
Yeah. So
That'd be incredible.
So that's what I'm going to do.
Fantastic.
Yeah.
Oh, we were meant to meet today.
I know.
So excited.
Yeah. Well,
that's incredible. See, I was singing for a reason.
I love it.
Yeah, me too.
Well, it's so much to meet you, Kylie.
Yes.
And follow me on my journey. And
absolutely. I can't wait.
I feel like a bit of an idiot, but you know what? I'm just going to show.
No, I love it. Thank you.
So I just got home. Kylie absolutely made my day. So be like Kylie and follow me on YouTube. So let's go set up this whiteboard. This is where all the magic happens. And by magic, I mean hours and hours of hard work, some tears, some wins. And you know how I said I had no attention to detail and that I was messy? Well, this is my desk. Pretty messy. And then this is my wife's desk. I don't want to bore you too much, but I guess I should tell you a bit about myself for those of you who have no idea who I am. So I'm 39 years old. My name's Yasmin, and I'm a nurse practitioner student. I'm going into my second year. And I guess for me, the journey in my nursing career has been about 15 years now. So I've worked in a variety of emergency departments and have been mentored by some great people, some of which have been on the podcast. And yeah, I just thought it was really important to share the journey because there's nothing out there. A lot of people don't know what a nurse practitioner is. And also these experienced clinicians who may not believe in themselves enough to take that next step and be a nurse practitioner because they've got fears of not being able to do uni work, not being able to afford it, not knowing where to sit within this space of choosing a niche or choosing mentors. And I'm really fortunate enough that I'm surrounded by people that know all these things. I don't know them. I'm not a great student. I don't learn the way that a lot of people do. So I guess for me, this is really important to document, and hopefully by the end of my year, you're still following me and you're inspired to take that next step. So let's talk about what this vlog's going to include. It's going to include weekly reflections, and I'll be talking about cases that I've worked up. Obviously, confidentiality will remain. So it'll be a generic chat through the patient's history, the examination and the differential diagnosis, and the reflection of myself, how I think I've learnt, performed, and also with my mentors. I don't think that I'll be able to get any mentor reflection sessions. This is also my own journey, and sometimes being on camera, the truth won't really get out, and I want to embrace myself in terms of this year and learning everything that I can, and that includes hearing the constructive feedback. I'm going to do some drills, the learning games that a few of the mentors have suggested to me, and I'll work through that, and you guys can see the outcome of what that looks like and whether you want to incorporate that into your practice or whether you incorporate those drills with your mentors. So I guess follow me. I am who I am. I'm very passionate about sharing the things that I learn. I love helping people grow, and I also am a person that's always half glass full, no matter what the situation is. What really does irk me is when someone says, "Oh, that can't be done." It can always be done. You just need to find a way through it. You need to believe in yourself, and you need to surround yourself with people who believe in you. And that's exactly where I am right now. I'm in a program where I've got amazing clinical support that support me in this journey. Hi. So I'm about to start working through my first case. We have our NP training day on Tuesday, Sunday. The time is 12:57. I know. You're probably thinking, why am I leaving this to the last minute? I can't really tell you that, but watch me. All right. So the case is 77-year-old female, mechanical trip and fall 8 days ago, head strike with facial bruising, left shoulder pain, and right-sided blurred vision. Please list and discuss at least 4 differentials. Discuss your assessment of this patient. For each differential, justify your investigations to rule in and rule out, and discuss your treatment plans for all of them. Discuss referrals, home or ongoing care. All right, so let's break it down so that we know. All right, so that's what we've got. Why don't you have a go and see what your 4 differentials are going to be, work through them, what tests you need to do to rule in and rule out, and what you would do for each of the diagnoses that you found. Let's go. I'm going to work through my worst case or red flag, can't miss differentials first. I'm going to talk you through my thoughts and how I'm getting there, what type of information I'm seeking, guidelines, websites, etc. We'll go from there. Hope you enjoy. I guess my red flags are going to be she's old. Adults have a higher increased risk of injury. So osteoporosis, there's definitely some frailty there. She's had a mechanical trip and fall. In my presenting complaint, taking that history, I want to know a bit more about this. I'll ask her, can you tell me about the fall? And if she can't tell me, then that means to me that there could have been a syncope. Was it cardiac? In the history, I'd also see if anyone witnessed that fall, so any witnesses. And if she can't tell me that history, then I am going to ask the witness of what the information was. If she can tell me the story about it was a definite mechanical trip and fall, then I can move away from this syncope cardiac episode to investigate more. I'm really bad at taking a patient history. I have no idea. I do have an idea. I can go through the motions, but I think listening and translating them into symptoms that are really important for me is just really overwhelming. And then organizing my thoughts of the differentials and then using those focus questions of what I think the differential is and remembering all of the information that the patient's telling me. So I've created this template that I'm going to trial this semester. I'll show you guys just a little bit about it. I've utilized Canva. It's my wife's account, not mine. I'll show you guys a little bit. So it looks like this. It's a 2-page document. It'll be in a book, and this will guide my questions so that I can process asking the patient the questions, being able to write a few things down, and then before I leave, it can help me cannot miss differentials, red flags, an intercerebral hemorrhage, a skull fracture, a spinal injury, retrobulbar hemorrhage, and a dislocation. I would also be thinking about some facial fractures, like a foot fracture and an orbital blowout fracture, which is causing compression on the facial nerves. I'm pretty sure it's the facial nerves, and also it controls the eye movement, so that I think it's cranial nerve 2, 3, 4, and 6.
And the inner aspect of his eye socket became fractured, resulting in a downward displacement of soft tissues into the hollow spaces adjacent to the eye socket. Let's look at an illustration of the normal structures that surround the eye. Here the eye appears as a circle in the center, surrounded by muscles that move the eyes up and down, side to side. They are interconnected by the orbital fibers, and the walls of the eye socket, also called in medical terminology the orbit, are surrounded by 4 bony walls. Notice that the inner or medial wall is adjacent to a hollow space called the ethmoid sinus, and the inferior wall is adjacent to a hollow space called the maxillary sinus. Next, we turn to an illustration of the normal bony architecture of the eye socket. Here we see that the bones on the floor and the medial wall are very thin and are vulnerable to breaks. This is actually a fortunate anatomic feature because the bones tend to fracture before the eyeball itself ruptures. We also see that there are tiny holes in the bones where the nerves exit the skull. These nerves give sensation to our upper face and teeth. These nerves are sometimes involved in orbital injuries as well. When a person is hit in the eye by a fist, exploding airbag, or a baseball, the pressure increases rapidly. The eye and surrounding tissues become deformed, and the floor of the orbit blows out. The bones and the contents of the orbit are forced downward, causing an entrapment of muscle, fat, and orbital fibers. We see from this frontal illustration that fat and fibers are pushed into the sinuses that surround the eye socket. The tissue that is trapped in the medial wall and inferior wall causes the muscles to become tethered, leading to double vision. In addition, the patient will appear to have a small, sunken eye.
I'm going to take a break now. It's 1:57. Not sure how long that took me. Yeah, so that's my messiness of working this patient up. So I just started using the blackboard of working out my differential diagnoses for my first session. Our workshop on Tuesday. It's absolutely terrible, by the way. So hopefully by the end of the year, I'll be smick and span. And yeah, but anyway, you guys can watch how I learn, how I grow, and how I go from a real novice to hopefully someone that's competent. Maybe. We'll see. Recording this vlog is so much harder than I expected it to be. Just working up my first diagnosis with you guys of that case study. Yeah, I can't even understand my mind of getting my thoughts out, let alone speaking about it out loud. Hopefully I get better as time goes on. I guess that'll go. I dropped my phone. I guess that'll come with confidence of working up patients. Probably shouldn't be vlogging while I'm writing either. Oh yeah, you like my hat? It's my daughter's. I think I look great. I never thought that I'd be so controversial to be deleted from a Facebook student nurse practitioner. Big in the world already, guys. Are my feelings hurt? I guess a little bit, because you just restrict my access to share my podcasts, but to be honest, not really. It's pretty hard to do this stuff and be on social media and show people your life, the highs and the lows. But in reality, all I want to do is get more nurse practitioners in Australia. I want to get the name nurse practitioner out in Australia. And I just want to grow this awesome profession and let people know who are struggling with making that choice. I also want to let patients know that they have access to not only a doctor, but a nurse practitioner to provide them with amazing care. So that's what I want to do. Interview amazing nurse practitioners, doctors, show you how to work through clinical reasoning as a student. And also, maybe I'll get some of the public to watch and they can see what an amazing choice a nurse practitioner is to provide you with healthcare.
Morning. It's 4:35 on Monday. And this is my normal wake up time, especially when I've got uni on and my mind always thinks. I had a pretty good sleep though, so pretty happy. So what I've been thinking about is this case, obviously, and that I think it might be easier if I break it down into diseases or systems. That's my dogs. Winnie. Lola. So I think what I'm going to do is write out all the systems that I can remember and then take you through what other diagnoses there could be, because I thought of some more ones. And that will guide, I guess, our tests to rule in and rule out. All right, let's do it. So, review of systems. Neuro. Head. ENT. If you don't know, just so you know, never say that a P comes from AF, because it doesn't, okay? I was that idiot. So make sure you do your research. It's totally different clot. And at least I was the one that really looked not educated on that front. Also, there's a traumatic pneumothorax, and then there's a primary and secondary pneumothorax as well, which I learned doing my respiratory job. Primary is without a respiratory disease and you have a spontaneous pneumothorax. Then if you have type a secondary, it's with asthma, COPD, and so you can get secondary spontaneous pneumothorax from that. Just so you know, depending on the respiratory disease, but 9 times out of 10, you'll need a drain for the spontaneous pneumothorax, whereas the first one, the primary Gerben study, if you haven't listened to that podcast, you don't need a drain, even if it's a complete massive pneumothorax. Traumatic, that's totally different. And I'll work through my differentials, cutting them all off with my history, taking those keywords. So I'll look up all of the once I have all of my symptoms of the patient, then I'll look up the diseases. So I nail off all of the diseases that I know that don't have those symptoms, and I will look up the diseases that I don't know all the symptoms to just double check. And then I'll work for my tests from there.
Just took the dogs out for a walk just to have a bit of chill time. I've been at it probably 3.5 hours now. Heaps easier without talking to you guys. I can kind of go through my thoughts. I'll definitely show you what I've got. And I'll hopefully learn how to talk out loud and get through this process throughout the year and get better for this vlog. But anyway, I'll show you what I've got this afternoon. The puppies are pretty happy after their walk. This year my goal is to balance my life a bit better too. So that means going to the gym twice a week, lifting some weights, going to jiu-jitsu twice a week, and walking my dogs every day. And that's going to be throughout the whole uni semester, hopefully. Drink 2 litres of water a day, eat healthy food, don't emotionally eat because I feel sorry for myself that I'm sitting and missing out on doing, fun stuff. But it's totally going to be worth it. I just need to remind myself of that.
I'm just going through all of the symptoms or all of the diagnoses. There's something called chronic exertional compartment syndrome. Never heard of it before. So it's a syndrome which refers to exercise-induced lower leg pain that is reversible with rest. Interesting. Anyway, look it up on ETG. I'm going to get back to it. So I finally found this on ETG. Had to click through a few things. ETG is a bit funny. You have to write a specific word and then it kind of picks up the stuff. So although I'm pretty sure that the management of a soft tissue injury is RICE principles, I just want to double check with the most up-to-date reliable source, and that's through the electronic therapeutic guidelines. As you can see, this is my PowerPoint presentation. So review of systems, I've broke it down into neuro, ENT, max-fax, head, ophthalmology, vascular, cardiac, resp, GI, GU, MS and other skin. And these are all of the potential diagnoses I have come up with before asking the patient anything. I guess my main reason why I'm wanting to go through the history again was, why is this lady coming 8 days after her injury? And these are all the things that I've thought about in terms of why she's come in and what I need to ask her. So my 4 differentials that I really narrowed it down to were the orbital blowout fracture, so swelling and bruising around the eye, the double vision. From the history presenting complaints, I need to get a bit more information. Clavicle or fracture or AC joint dislocation, so I've split it up into 2 there. Soft tissue injuries and my not to miss traumatic brain injury. From my physical examination, I want to go through head to toe on this elderly lady. I'm going to treat her like a trauma, but I guess these are the main things that I am looking for in my physical examination to help me rule in, rule out those diagnoses on the first page. Again, this is coming back to that review of systems and ruling in, ruling out of what I've got from the history of the presenting complaint as well as my physical examinations. Tests I'd run, this lady's elderly, she's got some facial bruising, so I'm definitely going to run a CT head and face, and then I'll be guided by the physical examination and the history of presenting complaint to see whether I need to do any x-rays or blood. For my treatment plans, if it was an orbital blowout fracture, I discuss or refer to the max-fax team, especially if she had a eye movement test that was impacted. In terms of clavicle fracture, AC joint dislocation, the classifications of the fractures are A, B and C, and you can see here where they are. I really want to see the patient first if they have a fractured clavicle, because If it is severely displaced or tenting, then I need to discuss this and refer to ortho more urgently than a fracture clinic referral. And then there's also brachial plexus injuries, subclavian vessel injuries, or a pneumothorax that I need to be aware of a complication from this injury as well. In terms of soft tissue, we need to just go through a full physical examination and seeing what limitations this lady has in range of movement. It's too long for the Rice method now. She wants to be thinking about loading early and increasing her range of movement and hopefully being guided by a community physio, and then giving her some regular Panadol. NSAIDs. She's elderly, so you need to be really careful of what other comorbid conditions she has, because brufen is bad potentially, and if she's got a traumatic brain injury, it's off to the neurosurgeons. But again, that's going to be through my history taking and physical examination. Now, with a nurse practitioner, we've got some holistic considerations that complement our care. So I'll be going through mobility and safety, some financial constraints, social supports, mental health and wellbeing. Depression is really increased in the older population, so just checking on that patient and making sure their mental health's okay. And I guess some cultural or personal beliefs, which is going to impact their care and returning to the hospital. GP follow-up, depending on what it is. For a soft injury, if it's not getting better, maybe there's a ligament or a muscle tear, that the GP can organise some more imaging. And then representation, FICE, infection, sepsis, PE, pneumonia, symptoms not improving. Noting that this lady's already 8 days into her injury, or what's caused this. Refer to allied health in the community we can do, and refer to our patient's clinic, depending on what's going on and how is she going to get there. So that's my case. That's what I'll be going to on Tuesday and presenting to the crew, and I'll report back to what the outcome was. All right. So everyone that was playing at home for this Stump the Chumps type case, I worked through all of my differentials. Took me, I think, between 4.5 and 5 hours in the end. Got to 4 top diagnoses, differentials that I thought of. Guess what? It was none of them. It turned out to be iritis, or uveitis is another name for it. So thanks, Loie, for stumping this chump. Obviously, it's a fun learning process, and we're all here to learn and grow. And this was definitely not, I guess, a case to make me look bad or anything like that. It's just making sure that you take the history and also look for other diseases that maybe not be associated with their presenting problem or what they look like. So definitely ask the patient, why they came here. So thanks, Loie, again. And hopefully you guys are enjoying this vlog of mine.